Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. We're in the month of January 2023, and January is usually known as the month of cervical cancer awareness. Joining me in studio today is Dr. Monique Williams, Women's Health Coordinator attached to the Maternal and Child Health Unit of the Ministry of Health. Also, Dr. Martin Campbell, Technical Officer for Cancer attached to the Chronic Disease Unit of the Ministry of Health. Welcome, guys.
Thank you.
Thank you for having us.
So today we're talking about cervical cancer, diagnosis and prevention. Dr. Martin, I know that cervical cancer is one of the leading cancers in women. Could you tell us of the situation here in Guyana? What has it been like over the years?
Okay. Like you correctly said, cervical cancer in Guyana is one of the leading causes of cancers. It is actually second to breast cancer. So it's a major issue for us here. It is a major issue generally in this part of the world, in developing countries. And with us here, it's no different. Cervical cancer, in Guyana, over the years, we've noticed, you could say, a stable trend. It's not increasing much, or it's not decreasing, but the rates are generally stable. Unfortunately, we haven't been able to put a significant dent in the number of cases being diagnosed. Just last year at the Georgetown Hospital alone, there have been over 150 new diagnoses. Wow. And that's just a proportion of the overall in the country, because of course, persons would attend private clinics and so forth. So we really have work to do in terms of decreasing the number of cervical cancer cases we have in Guyana.
Yeah, definitely. What implementations and strategy has Guyana adopted to better combat this cancer, as well as monitor those cases across the regions?
Right. So in Guyana, we've had various strategies implemented to help to prevent cervical cancer, because that's the main strategy in combating cervical cancer is prevention. So we've had the vaccination campaign, the HPV vaccination campaign, which is the HPV is the cause of cervical cancer. And we've had that vaccine available for many years now. We've rebranded the campaign of recently, and the vaccine is now available to older women as well, up to 45 years of age. So apart from the vaccination campaign, we've had a screening campaign as well, based in VIA, visual inspection with acetic acid. And that's also available throughout Guyana in all the different regions. So those are the two main pillars. Of course, we wanna promote and provide more sensitization on cervical cancer and why you should get screened and why you should get vaccinated.
Definitely. What has been the response like from women across the regions? Because I know that you guys do a lot of outreach programs within the regions and so forth. How has women been responding with regards to getting screened and getting screened early?
Right. So the response is generally positive. Women, once they're informed, once they know about cervical cancer, once they know about the methods of prevention and screening, they're usually open to being screened. The issue is we're not getting across to women as much because, of course, the healthcare system and healthcare workers are generally tasked with multiple different responsibilities. So oftentimes the providers, VIA providers, and other healthcare workers aren't able to get into the communities as often as they like to provide that information. So we're also working on a mass media campaign so we can bring greater sensitization.
Yes, definitely.
Throughout the country.
What is the leading cause of cervical cancer?
Right. So the main cause of cervical cancer is HPV, human papillomavirus.
As you mentioned before,
Right. So that virus tends to affect the cells of the cervix in a way that causes deformation or changes to the cells. So that is basically the cause of cervical cancer. But there are other risk factors that can increase that process, make that process more likely. One, for example, women who might be immunocompromised. So that, of course, increases the risk of developing cervical cancer once they've been in contact with HPV. We found that women who've had 3 children or more tend to have an increased risk. Women who have a family history, for example, if the mother, sister, very close relative, had cervical cancer, those women also tend to have an increased risk because of the genetic factor, genetic susceptibility. We also find that women, once you've had any infection, sexually transmitted infection, that increases your risk of contracting HPV and changes that can happen, that can create as well.
Thank you so much, Dr. Campbell. We're going to go into a short break and be right back with more on cervical cancer, diagnosis, and prevention.
A woman's life can be filled with tremendous possibilities if you have a healthy body. Yet, cervical cancer continues to pose a constant risk to women today due to low awareness. Cervical cancer is the growth of abnormal cells in the cervix. If left undetected, these cancerous cells can spread to other parts of the body. Comparing to screening for other gynecological cancers, modern medical advancements have made it easier to identify the warning signs of cervical cancer. Hence, it is also one of the most preventable cancer with regular screening like the Pap test and HPV test. In fact, many survived from cervical cancer as it was detected and treated in the early stages. In Singapore, women aged 25 to 29 who had any sexual activity are advised to take Pap test once in 3 years. A doctor or nurse will use a small disposable spatula to collect some cell samples from the outer opening of the cervix. These samples will be sent to the lab to detect for any abnormal cells before it turns cancerous. One of the major causes of cervical cancer is human papillomavirus infection, also known as the HPV infection. Most sexually active men and women are infected with HPV at some point in their lives. While most HPV infections can be cleared by the body naturally, especially in younger women, persistent infections of certain high-risk HPV types can result in cervical cancer. Therefore, women aged 30 and above are advised to do HPV testing once every 5 years. Sampling is done in the same way as a Pap test, but HPV testing is much more sensitive and accurate. To help reduce the incidence of cervical cancer, the Singapore Cancer Society provides cervical cancer screening at no cost at the SCS clinic at Bishan for eligible females who meet the following criteria. Remember, cervical cancer is the most preventable cancer with regular screening.
Welcome back. For those persons who have just joined the program, today we're talking about cervical cancer diagnosis and prevention. Dr. Monique Williams, I know that you've been doing a lot of work too in the regions and you've been addressing many health concerns affecting women, which cervical cancer is one of those. Could you explain what cervical cancer really is and how it is developed for those women who probably would have just tuned in and probably don't have much understanding of what this cancer is? Could you explain for us, please?
Okay, so first thing, we all know that cancer is an abnormal growth of
Yes.
cells. All right, and if we're going to say cervical cancer, it means that we have that abnormal growth of cells within the cervix. Now, it's important to mention that only females have a cervix. All right, so you find this condition in women only. All right, so cervical cancer is developed in the cervix, and most of the times it is because of HPV infection. HPV infection is responsible for approximately 90% of all the cervical cancer cases. It's important to mention here too that because HPV is such a common strain, we have at least about 150 different types of HPV. So it depends on the type that you have that will cause you to be exposed to cancer.
Okay. Does the cancer take a period of years to develop? How long does it take to develop?
Well, data tells us that it takes roughly about 12 years from the time you're exposed to when you actually can say that you have cancer. Because the thing is, HPV, when you have the infection, most of the times it's asymptomatic. So you're not aware that you have the condition until you start presenting with serious symptoms.
Which therefore means that a woman can have this HPV and have this cancer and not experience no symptoms until probably the late stages of it.
Correct.
Okay. What are some of the symptoms that women should look for?
So one of the first things or one of the first clinical indications that you may be in the presence of a cervical cancer is postmenopausal spotting. That's when a woman who would have had no period or amenorrhea for more than 12 months starts to spot or starts to bleed. We usually advise these women to go quickly to your doctor so that you can be evaluated.
Does this happen during sexual intercourse as well? Women experiencing spotting or bleeding or so?
Well, there are some cases where you would experience post-coital bleeding, which can also be an indication of possible cervical cancer as well. All right, so these are some of the key things that we need to pay attention to. And we would advise women that, when these things happen, go quickly to your doctor and get yourself evaluated. Those are some of the classical symptoms. Of course, you're going to have symptoms when it's already far gone. You
Yeah.
have some complications with your bones, osteoporosis, and all these kinds of things, but that's when it's far, far gone.
Yes. There's a belief that regular pap test is enough to protect women against cervical cancer. Is this true?
Pap smears are the gold standard. All right, but you got to remember that there are other factors that causes you or predisposes you to getting cervical cancer. So while we would recommend that you have your regular pap smears, which is every 3 years you get your pap smears done, and that's in the event that it's a negative pap. If you would have done it and you had a positive pap, you go back the next year and get it done as well. But you got to take into consideration your lifestyle as well. Dr. Martin mentioned earlier, if you would have had multiple sexual partners as well, it also predisposes
Yeah.
you at or puts you at risk of developing cervical cancer. We also have your parity, how many children you would have had. Um, that also is a factor.
Okay. There's a belief that if there is regular screening done and vaccination, then we wouldn't be having this conversation about cervical cancer. Let's talk about prevention. Could you talk about the importance of getting screened?
Screening is very, very important. Very, very important. Because with screening, you have early detection, and in the event you're in the presence of, precancerous cells or cancerous cells, it's so early detected, management is much more optimum. You have much more viability in terms of, the treatment and stuff like that. So we will encourage women to get out there to get your pap smears done, get your VIAs done. All right, because this early detection is what saves lives.
I know a lot of women are nervous and a bit iffy about going and get screened and doing a pap smear, even doing a VIA. What can women expect through that process?
All right, so getting a VIA done, getting a pap smear done, and yes, women are scared, but it's not a scary process. It's a little bit discomforting. It's not scary. So what happens when you go into your provider is going to have a conversation with you. They're going to go through some routine questions, you answer them, and of course after then, if it's okay to go ahead with the examination, they're going to ask you to get in the bed, get in the gynecological position, and they're going to insert a speculum. That's a device that we use to open up the vagina so that we can have a clear visual of the cervix. Now that part is the discomforting part, and of course when we're swabbing the area, you can feel a little bit discomfort there. But as soon as that process is over, it's done.
So, is there a specific
easy
age
done.
range for getting this screening done? Do you have to be of a specific age?
Well, we encourage women of reproductive age, 25 to 49, to get their pap smears and VIAs done. But we also encourage women who are sexually active to also get your pap smear done. So if you're sexually active before the age of 25, you should be getting screened for
For women
cancer.
who are diagnosed positive with cervical cancer, or we see something that is there that may turn into cancer, what is next? What is the next steps for those persons?
So after we would have determined this, the next step is that we will refer them to our main referral hospital, of course, UPHC, where they will now be evaluated by a doctor there and determine what is the next management. Because there are different types of management depending on what they see. If
Yes.
it's precancerous cells, cancerous cells, they'll be able to determine from there what the management would be. So they're
For-
usually referred
Yes.
to GPHC.
For cancerous cells, what treatments are available currently?
So, well, just doubling back. So normally with the screening ones, we detect anything.
Yeah.
It depends on the screening test that's done. If it's a pap smear, usually those are the cases that are referred for colposcopy or another further evaluation. If it's VIA, usually we're able to treat those. So that's a good thing about VI is that once we detect abnormalities there, and the look of it, because it's a visual examination, right? If it looks a certain way, if it reaches a certain criteria, we can treat it right there and then get rid of that, right? In other cases, those are the ones we would refer. So once we were able to detect or diagnose cervical cancer, which is through biopsy or so, there's treatment available at Georgetown Hospital free of cost. There is chemotherapy that's at the oncology unit. In some cases, women will need radiotherapy or brachytherapy, as they call it. That is available through a collaboration with the Cancer Institute of Guyana.
Okay, where can persons go to get screened? I know some persons would usually go to their nearest health centers, but apart from there, where else can they go?
Right. So there are many, many health centers and health facilities across the country that offer VIA screening. And so I'd advise you to just go to your healthcare provider and just have a discussion first.
Yes.
So that they can direct you to the closest facility. It may be a facility right in your community. It may not be a facility right there. It might be one close by.
Okay, thank you so much. We're going to go into another break and be right back with more on cervical cancer.
Cervical cancer produces no symptoms in the early stages, which means every woman should get tested routinely to be detected early. Visual inspection with acetic acid, commonly known as VIA screening, looks at the cervix to detect abnormalities. Diluted solution of acetic acid is applied, and this detects the precancerous lesions before it progresses into full-blown cancer. The VIA process is pain-free, quick and simple, and results in treatment are immediate and free. VIA-positive women can undergo cryotherapy treatment or freezing of the precancerous cells, which takes less than 15 minutes. Remember, VIA is safe even during pregnancy, is free and only takes a few minutes, is suitable for sexually active women. Get screened every 3 years or as recommended by your healthcare provider. A few minutes could be life-saving. VIA screening can be accessed at selected public hospitals and health centers countrywide. A message from the Ministry of Health Chronic Disease Unit.
Thank you for staying tuned with us. Before we wrap up the program, we have more to tell you about HPV vaccination, how you can get it. Dr. Monique as well as Dr. Martin, could you tell us about that? We know that HPV is one of the leading causes of cervical cancer in women. How can persons get the HPV vaccine?
All right, so the HPV vaccine is available in our public system. It is available at all our health centers. It's available for boys and girls between the ages of 9 to 16, and it's also opened up to women until the age of 45.
Okay, so persons can probably visit any of their nearest health facilities
to receive the vaccine.
What do you guys have planned for the course of this month of January with regards to cervical cancer awareness?
Okay, so the Women's Health Department, we have a few pop-up clinics planned for the Cervical Cancer Awareness Month. It's going to be at the Festival City Polyclinic in South Ruimveldt and the Dorothy Bailey Health Center on South Road. What we have planned is that we're going to be providing VIA screenings as well as pap smear. There's also going to be the availability of HPV vaccines at these sites. So we're going to have a brief sensitization session about what cervical cancer is, the risk factors and stuff like that. And then we'll invite our women to come and get screened, as well as for those who would not have had the vaccine, they will also be in a position to receive the vaccine there.
Okay. What would be your encouragement to persons who are watching, especially women, with regards to screening? We know we are pushing prevention, and so preventing cervical cancer means that more persons got to get screened. What would be your encouragement to persons who are watching now?
So prevention is really key. And the thing about it is that cervical cancer is one of the most preventable cancers there. It's almost 100% preventable, right? We have the vaccine that is 99 to 100% effective, right? And as well as all these screening methods, VIA and the pap smear. So I would encourage women to just get the information that you require, get informed, speak to your healthcare provider, do your little research. The internet is available to us. Get that information, get yourself vaccinated, right? The vaccine is now available to women up to the age of 45 years of age, Of course, we're focusing on the younger generation, the
Yes.
between 9 to 16 boys and girls. So if you're eligible for the vaccine, go and get the vaccine. It will help to prevent cervical cancer. And of course, get screened, right? You need to get screened. That's the only way we can see if anything is happening at this level of the cervix. And once we're able to detect something, if something is there, detect it, we can treat it, we can get rid of it so that you don't have to go through the pain and suffering of cervical cancer.
Definitely. Dr. Monique, anything you would like to add?
I would just like to encourage the mothers out there with their children. I know sometimes it can be a little bit iffy in terms of the information that is out there. I just want to encourage you to do your little research. The healthcare providers are always there to provide additional
Yes.
information. And, get your boys and girls screened. As Dr. Martin said, it's almost 100% preventable. And that's if you're informed, if you get screened, and if you get vaccinated. All right, so get informed, get screened, and get vaccinated.
Thank you, guys. Thank you so much for joining me on the program today. And I want to encourage you to keep up the good work that you have been doing at your various departments. Thanks once again.
Thank you for having us.
This has brought us to the end of Health Matters for today. Thank you, our listening and viewing audience, for staying tuned with us. I'm Alicia Martin saying goodbye for now.